Hey, what's up guys? My name is Quest and I'm doing this video because I found that there was a general lack of information or a up-to-date lack of information on benzodiazepine medicines available within Australia. So I decided to make a short YouTube video to give a bit of information on that for those who are interested. To start off, I'll cover what a benzodiazepine is. Benzodiazepines are a class of drugs that are usually only prescribed for short-term use, 6 weeks maximum, sometimes longer, depending on the individual and the doctor. It's at the doctor's discretion, though 6 weeks is the Australian PBS standard for the length that benzodiazepines should be prescribed for. They are sedative, anti-anxiotic, and muscle relaxant drugs. They have a antagonizing effect on the GABA receptor found in the brain, and they also have a number of other smaller interactions with neurochemicals in your brain that attribute to the sedative effects. So to go over a couple of the different brands and drug names that are commonly available on PBS in Queensland, Australia at least. The most common one you'll find is diazepam. This is sold under a number of different brand names depending on where you are in Australia. One of the most common ones is Antenex. This is it's always 5 milligram or 2 milligram. The most a doctor can prescribe is 55 milligram pills, but you can get authority scripts for more if you're suffering from a more severe condition that requires a higher amount of the drug, or if perhaps you have a larger BMI that requires a more pronounced amount of the drug. But generally 10 milligrams a day is the standard dose, so 2 of these a day, so 1 bottle is generally kind of a month's worth because it's to take as needed. So it's not intended when the doctor gives you this medication that you are to be taking it every single night. You should only take it when you feel you need something to. Maybe if you're someone who drinks a lot and you're trying to give up on alcohol, benzodiazepines are a way to substitute alcohol to take the edge off. They have the same effect as alcohol does. A lot of the same interactions with the brain as alcohol does. Diazepam especially. Diazepam is an interesting drug because a lot of the other benzodiazepines I'm going to cover are actually metabolic actives of diazepam. One that I'll get out of the way now because I don't have an example of it on hand is Seropax, oxazepam. Anyone who takes diazepam and metabolizes it properly will find small amounts of oxazepam in their blood afterwards. They'll also find a small amount of this drug called lormetazepam. Lormetazepam is the metabolic active of both temazepam, also branded as Normicin, but sold under another number of generic names, most commonly Apotemaz or Temtabs, and then another drug called nitrazepam, Alodorm or Mogadon. Both of these drugs largely metabolize into lormetazepam, and that is a direct metabolic active of diazepam in the first place. The difference being that diazepam takes longer to metabolize, therefore the sedative effects aren't as concentrated, where the sedative effects brought on by lormetazepam, that is to say, aren't as concentrated. Whereas in drugs like Alodorm, Mogadon, nitrazepam, whatever you like to call it, or temazepam, the sedative effects are concentrated. And these drugs are designed to directly metabolize into lormetazepam and have a sedating effect. The same can be said for other drugs not sold in Australia, such as triazolam, flurazepam, also lorazepam, which we'll get to in a minute, and another drug that's not sold in Australia is the direct concentrate lormetazepam, which is sold in Italy under, I don't know what the brand name is. going back to diazepam, you may also have already heard of diazepam as Valium. That is the most common, well, not the most common, but the brand name for the drug. So doctors will often write out a script for Valium 5 milligram 50 pills, or 10 lots of 50 pills to be given over X amount of days. And but when you take the script to cash in, you can say, I just want generics, and they'll give you a brand that is either going to be Valpam, Antenex, Apodiaz. It may not necessarily be Valium. In Queensland, on PBS, this packet costs $22 over the counter. That is with a prescription. There are some other sorts of benzodiazepines that are commonly prescribed for disorders in Australia. One that before I get into my bag of pills here, one that I do not have on hand is clonazepam, which is only prescribed in Queensland for cases of neurologically proven epilepsy, which is uncommon. But those pills come in 0.5 milligram, which are sometimes also prescribed for mild anxiety, and 2 milligram pills. It's also commonly sold under the brand name Paxum. It's a very powerful benzodiazepine with a long metabolic half-life. This is Ativan. This is lorazepam. I believe that they still hold the patent on this drug, so it is only sold under the brand name Ativan, and it costs about $50. It comes in 2.5. This is a 2.5 milligram bottle of pills. 2.5, 1 milligram, and 0.5 milligram pills. It has its primary metabolic is lorazepam, but it releases it over longer duration than temazepam or mogadon, trazepam. Another very common benzodiazepine that's sold on the streets is this Karma or Elprax. These used to be available in a 2 milligram pill, but those have since been discontinued in 2016. This is usually used to treat short-term panic attacks that have severe effects on the patient. So if the patient's suffering from disabling, crippling panic attacks, alprazolam may be prescribed for use as the panic attack occurs. It kicks in quite quickly within 15 to 20 minutes, I believe, and hangs around for about 6 hours, but it can be quite a strong sedative and is often used recreationally. It has a slightly different molecular structure to regular benzodiazepines, where it's almost closely related to triazolam-based benzodiazepine compounds, and that's going into a whole different range of drugs like atazolam, flibromazolam, flunitrazolum. Those are thiendodiazepines, which are a different class of drugs altogether, so we won't cover those today. But that's a look at the most common benzodiazepines you'll find in Australia. If I can quickly go over them in my head, I would say that those available in Australia that fall under benzodiazepines are diazepam, nitrazepam, temazepam, oxazepam, lorazepam, temazepam. I'm not sure if I already said that one. Alprazolam. Midazolam, which is only used in hospital settings. It's rarely used in outpatient settings. It's branded as Dorsium. Wouldn't have any of that on hand. Flurazepam, which once again only used in medical settings, and bromazepam, which I believe is used in Western Australia still. There's also a Z drug, which is a class of drug called Z drugs, one that's available in Australia that's very closely related to benzodiazepines, called Zopiclone, and it is branded as I'm afraid I cannot recall the brand name of Zopiclone. Imovin. It is branded as Imovin. in Australia and or in Western Australia where it's sold. So that pretty much covers it for benzodiazepines in Australia. If you have any further questions, don't feel afraid to drop me a line. I will answer any pharmaceutical questions. Keep in mind, I am not a registered pharmacist or a doctor, or really have any priority role in the medical setting. I am simply a pharmacological enthusiast and believe this information should be widely available. So I hope you enjoyed this video. It's Quest signing off. Peace.